A 64-year-old male with a history of hypertension and type 2 diabetes mellitus is prescribed a beta blocker for his hypertension. In this patient with both hypertension and type 2 diabetes, managing blood pressure is crucial to reduce the risk of complications like stroke, heart attack, and kidney disease. Which of the following beta blockers is most appropriate in this patient, given his comorbidities? A. Propranolol, B. Carvedilol, C. Metoprolol, D. Nadolol. The right option is B, that is Carvedilol. Carvedilol is a non-selective beta blocker with alpha-1 blocking properties. It has been shown to improve insulin sensitivity and is a good choice for patients with both hypertension and type 2 diabetes. Metoprolol is a beta-1 selective blocker and a reasonable choice for diabetics. However, Carvedilol has the added benefit of alpha-blocking activity, which improves insulin sensitivity. Propranolol is a non-selective beta blocker that blocks both beta-1 and beta-2 receptors. It can mask hypoglycemia symptoms and impair glycemic control, making it unsuitable for diabetic patients. Nadolol is a non-selective beta blocker that blocks both beta-1 and beta-2 receptors. Blocking beta-2 receptors can interfere with glycogenolysis and glucose release from the liver, which can worsen glycemic control and increase the risk of prolonged hypoglycemia in diabetic patients. For this reason, it is generally not recommended for patients with diabetes. Now answer this question: that a patient with 115 mg per deciliter is considered as hyperglycemic, diabetic, prediabetic, or normal? Comment your answer below. Next case, a 55-year-old male with a history of hypertension, chronic kidney disease, CKD, and type 2 diabetes is being treated for his elevated blood pressure. His physician decides to prescribe an angiotensin-converting enzyme, ACE, inhibitor to manage his hypertension and protect his kidneys. Which of the following ACE inhibitors would be the most appropriate choice? A. Enalapril, B. Captopril, C. Lisinopril, D. Ramipril. The right option is D, that is Ramipril. Ramipril has been shown in clinical studies, for example the HOPE trial, to have cardiovascular and renal protective benefits in patients with diabetes and CKD, making it the most appropriate choice for this patient. While effective for hypertension, enalapril has no specific benefit over other ACE inhibitors in patients with CKD and diabetes. It can be used but is not the preferred option. Captopril is short-acting and requires multiple daily doses, which may lead to poor adherence in a patient with chronic conditions. It is generally not the first choice for long-term management. Lisinopril is widely used for hypertension but lacks the specific cardiovascular and renal protective benefits that have been studied with ramipril in diabetic patients. Now answer this question: that blood pressure of a patient is measured at 148 by 92 mm mercury on two separate occasions. It's elevated blood pressure, stage 1 hypertension, stage 2 hypertension, or hypertension crisis. Comment your answer below and check out the ranges for blood sugar levels and blood pressure according to ACC and AHA guidelines. For more pharmacology content, subscribe to our channel and hit the bell icon.